Have you ever wondered whether drug dependence and addiction are the same thing? While many people use these terms interchangeably, they refer to different aspects of substance use and can have very different implications for treatment and recovery. Understanding the difference is essential to guide more effective intervention and healing. According to the National Institute on Drug Abuse, nearly 20 million Americans struggle with substance use disorders, a number that highlights the urgent need for clarity and accessible treatment options. Today, we will explore the key distinctions between drug dependence versus addiction and discuss the signs, causes, and treatment options available for those seeking to reclaim their lives and move forward in their recovery. So, if you're still wondering, addiction and dependence are not the same. Addiction is a disease that affects the brain and behavior, leading to an inability to control the use of a substance. It involves craving for the substance and an inability to stop using it despite potential negative consequences. On the other hand, dependence occurs when the body adapts to the presence of the substance and experiences withdrawal symptoms when the substance is reduced or stopped. It's important to note that addiction and dependence can occur together, but they are distinct concepts. Addiction involves the psychological and behavioral aspects of compulsive substance use, while dependence is primarily a physical reliance on the substance to prevent withdrawal symptoms. Understanding the differences between addiction and dependence is crucial in order to address substance abuse and provide appropriate treatment. By recognizing the unique characteristics of addiction and dependence, individuals and their loved ones can seek the necessary support and resources to navigate the challenges associated with substance misuse. Let's further explore what drug dependence is. So, drug dependence refers to the physiological and psychological need for a substance to function normally. Physical dependence, that's how the body adapts to drugs. Physical dependence happens when the body adapts to the presence of a drug to the point where its absence triggers withdrawal symptoms. These symptoms can vary in intensity, from mild ones to severe, such as seizures or nausea. Over time, tolerance also develops, meaning the person needs more of the substance to achieve the same effects. It's important to note that while physical dependence can occur with many substances, including alcohol and prescription medications, it does not necessarily indicate addiction. Now on to psychological dependence, cravings, and emotional reliance. So in addition to physical dependence, individuals may also experience psychological dependence. This is characterized by an emotional reliance on the drug to cope with stress, anxiety, or other emotional challenges. A person may crave the substance as a form of comfort or relief, and these cravings can be difficult to resist. Moving on to addiction. Now, addiction is a more complex condition. This goes beyond physical and psychological dependence. It is characterized by persistent substance use despite the negative impact it has on the person's health, relationships, and overall well-being. Addiction affects both the brain and behavior, leading to an inability to control substance use. Addiction is not just about the substance. It is about the behavior surrounding the substance use. Individuals with addiction often engage in risky behaviors, neglect responsibilities, and experience a loss of interest in activities that once brought them joy. Emotionally, addiction can lead to mood swings, anxiety, depression, and feelings of hopelessness. A key feature of addiction is compulsion, the uncontrollable urge to continue using the substance, despite the negative impact it may have on one's life. This compulsion is often driven by changes in the brain's reward system, which can be triggered by the substance, making it hard for the individual to stop. Key differences between drug dependence versus addiction. While both drug dependence and addiction involve a physical and emotional relationship with a substance, there are important distinctions between the two. Drug dependence occurs when the body adjusts to a substance, resulting in the need for higher doses to achieve the same effect and experiencing withdrawal symptoms when use is reduced or stopped. Addiction, on the other hand, involves compulsive behavior and a loss of control, often with a psychological craving for a substance. Signs of drug dependence versus signs of addiction. So some of the signs of drug dependence include increased tolerance, withdrawal symptoms when the drug is not available, continued use despite negative physical effects. Some of the signs of addiction include compulsive drug-seeking behavior, neglecting personal and professional responsibilities, persistent cravings and emotional distress, engaging in risky behaviors related to drug use. So how can drug dependence lead to addiction? Drug dependence and addiction are closely linked, though they are not the same. Dependence occurs when the body adapts to a substance, leading to tolerance and withdrawal symptoms. Initially, the individual may use the drug to avoid physical discomfort, but over time, the reason for using shifts from physical relief to emotional and psychological coping. This transition sets the stage for addiction, where the substance is no longer used for just relief, but to manage cravings and emotional distress. The brain's chemistry plays a significant role in this shift. Drugs trigger the release of dopamine, a neurotransmitter linked to pleasure and reward. Repeated use alters the brain's reward system, diminishing its sensitivity to natural rewards and making the individual increasingly reliant on the substance to feel normal. As the brain changes, addiction takes hold, making it harder to stop using despite harmful consequences. Early recognition of signs and seeking support can prevent progression, but treatment must address physical and psychological factors. So you may be wondering if you can have dependence without addiction. The answer is absolutely. One can be dependent on a substance without being addicted, as dependence focuses more on physical reliance rather than compulsive behavior. So, for example, someone who takes prescription medication for chronic pain might become physically dependent on it. Their body gets used to the drug, and if they suddenly stop, they might experience withdrawal symptoms like headaches or nausea. However, they may not feel the intense cravings or loss of control that typically comes with addiction. Essentially, they depend on the substance to function daily, but don't engage in compulsive behaviors or actively seek the drug. So while dependence can be a part of addiction, it doesn't necessarily mean someone is addicted. It's more about how the substance affects their behavior and emotions. Moving on to the importance of early intervention for dependence and addiction. Early intervention plays a critical role in preventing the escalation of drug dependence into full-blown addiction. Recognizing the early signs of dependence, such as the increased need for the substance or the development of tolerance, can make all the difference. The sooner someone reaches out for help, the more likely they are to avoid serious long-term complications. Addressing substance use issues early allows individuals to gain control before their behavior spirals out of control. With the right support, they can break the cycle of dependence and reclaim their well-being. Early intervention is key to giving individuals the tools and strategies they need to navigate life without relying on substances. Let's discuss tolerance and withdrawal symptoms. Tolerance is a phenomenon commonly associated with physical dependence. It occurs when the body requires higher doses of a substance to achieve the same effect as before. With continued use, the body becomes less responsive to the substance, leading to the need for increased amounts to achieve the desired outcome. Withdrawal symptoms are another characteristic of physical dependence. When an individual abruptly reduces or stops using the substance, the body reacts with a range of physical and psychological symptoms. The severity and duration of withdrawal symptoms can vary depending on the substance and the extent of physical dependence. Withdrawal symptoms can include, and it's important to note that physical dependence and withdrawal symptoms can occur with various substances, including opioids, alcohol, and certain medications. Seeking professional guidance is essential when managing physical dependence to ensure a safe and effective approach to tapering off the substance. Understanding the distinction between physical dependence and addiction is crucial in addressing substance use disorders. While physical dependence involves the body's adaptation and reliance on a substance, addiction encompasses compulsive behaviors, cravings, loss of control, and continued substance use despite harmful consequences. Seeking appropriate treatment and support is essential for individuals struggling with both physical dependence and addiction to achieve recovery and overall well-being. So when it comes to addressing addiction and dependence, different treatment approaches are necessary to help individuals overcome these challenges and regain control of their lives. The focus of treatment for addiction primarily involves behavioral therapies and medications, while managing dependence often involves safely tapering off substances. So for drug dependence, medication-assisted treatment is available. Medication-assisted treatment helps manage withdrawal symptoms and cravings. Using medications like methadone for opioids or disulfiram for alcohol dependence. Another treatment is tapering and detox. Gradual reduction of the substance under medical supervision helps ease withdrawal symptoms and safely clears the drug from the body. The approach for addiction may be behavioral therapy and counseling. Therapies like cognitive behavioral therapy help individuals manage cravings and address the psychological aspects of addiction. Another approach for addiction may be inpatient-outpatient rehab. Inpatient rehab provides 24/7 care in a controlled setting, while outpatient rehab offers flexibility for those needing less intensive supervision. And another approach for addiction would be aftercare programs, and that includes ongoing therapy, support groups, and sober living arrangements, helping individuals to stay focused on their recovery and avoiding relapse. Recovery from drug dependence and addiction is possible, and many individuals go on to lead fulfilling, substance-free lives after treatment. With dedication, self-care, and the right support, a healthier and happier life is achievable. Part 2, Strategies to Manage. In a world where drug dependence and addiction affects millions, understanding effective management strategies is crucial. we will explore various approaches that can help individuals regain control over their lives. First, recognizing the problem is the essential first step. Individuals must acknowledge their substance use and its impact on their lives. This self-awareness can be a powerful motivator for change. Next, seeking professional help is vital. Treatment options vary, including therapy, counseling, and medication-assisted treatment. Cognitive behavioral therapy, for instance, helps individuals identify and change negative thought patterns associated with addiction. Group therapy provides support and shared experiences, fostering a sense of community. Medication-assisted treatment combines behavioral therapy with medications to reduce cravings and withdrawal symptoms. Drugs like methadone and buprenorphine are commonly used for opioid dependence, while naltrexone can help with alcohol dependence. Consulting with a healthcare professional can determine the best approach. Building a support network is another critical strategy. Friends, family, and support groups can provide encouragement and accountability. Programs like Alcoholics Anonymous and Narcotics Anonymous offer structured support and shared experiences, helping individuals feel less isolated in their struggles. Developing coping skills is essential for managing triggers and cravings. Techniques such as mindfulness, meditation, and stress reduction exercises can help individuals navigate challenging situations without resorting to substance use. Journaling can also be a valuable tool for self-reflection and emotional processing. Establishing a healthy routine is vital for recovery. Regular exercise, balanced nutrition, and adequate sleep can significantly impact mental and physical well-being. Engaging in hobbies and activities that bring joy can also distract from cravings and promote a fulfilling lifestyle. Setting realistic goals is crucial in the recovery journey. Individuals should break down larger goals into smaller, achievable goals. Celebrating these small victories can boost motivation and reinforce positive behavior changes. Education about addiction is another key strategy. Understanding the science behind addiction can demystify the experience and reduce feelings of shame. Knowledge empowers individuals to make informed decisions about their recovery and seek appropriate help. Addressing co-occurring mental health disorders is essential for effective treatment. Many individuals with substance use disorders also struggle with anxiety, depression, or trauma. Integrated treatment approaches that address both addiction and mental health can lead to better outcomes. Creating a relapse prevention plan is a proactive strategy. Individuals should identify triggers, develop coping strategies, and establish a support system to turn to during challenging times. Having a plan in place can reduce the likelihood of relapse and promote long-term recovery. Engaging in aftercare programs is crucial for maintaining progress after initial treatment. These programs offer ongoing support and resources, helping individuals navigate the challenges of everyday life while staying committed to their recovery goals. Practicing self-compassion is vital throughout the recovery journey. Individuals must recognize that setbacks may occur and that recovery is not a linear process. Being kind to oneself during difficult times can foster resilience and encourage continued efforts towards sobriety. Incorporating holistic approaches can also enhance recovery. Techniques such as yoga, acupuncture, and art therapy can promote relaxation and emotional expression. These practices can complement traditional treatment methods, providing a well rounded approach to recovery. And finally, staying informed about new research and treatment options is essential. The field of addiction treatment is continually evolving, with new strategies and medications emerging. Remaining open to new possibilities can enhance recovery efforts and provide individuals with the best tools for success. In conclusion, managing drug dependence and addiction requires a multifaceted approach. By recognizing the problem, seeking professional help, building a support network, developing coping skills, and establishing a healthy routine, individuals can take significant steps toward recovery. Education, addressing co occurring disorders, and creating a relapse prevention plan further enhances the chances of success. Practicing self compassion and incorporating holistic approaches can provide additional support on this journey. Staying informed about new research ensures that individuals have access to the best resources available. With determination and the right strategies, recovery is possible, leading to a healthier, more fulfilling life.